This isn't just one more program or product or one more employee benefit. My vision is that this is a model that takes the place of the solutions that are already in the market and have been for years that fall short. The healthcare system, everybody's got their own incentives. They're misaligned. They're focused on physical health and the cost. This is a model that is upstream, helping people before they enter that system and helping them with a model that is all-encompassing and is really focused on them as individuals, not just a one-size-fits-all, here you go. This is, what do you need? Where are you? What's happening with you? And how can we support you? And that's what we do.
When I think about the work that I was doing in the roles I've played in HR, it all comes down to human behavior and humans behind the behavior. And what I was finding for myself is that over and over, I was seeing the same problems. I would sit down and coach an employee, and we would be talking about maybe building her confidence in front of a room. And we would realize she had headaches before a big presentation. And she had gone and gotten migraine medication, seen her doctor. And I have story after story after story that I'm sitting in the seat of being an HR leader, seeing the physical manifestation of what employees were experiencing as a result of their psychological or social or even organizational circumstances. And it became so apparent to me personally that we had to do something as an employer to make a difference.
When you're helping people stay on a good path and lowering the stress that goes with all of that, there's real outcomes that can be measured. Now they're not going to the doctor because they feel supported. Now they're not spinning out of control because of poor diet, lack of exercise, just really letting themselves go, or being depressed because of how hard it is to day in and day out manage a chronic disease. And so it's that emotional support and the motivation and education and keeping people staying the course. This is what WellSpark does. And this is where we see real results: lowered hemoglobin A1C, lower blood pressure, lower weight, but also we're measuring the emotional side of this and say, how are people feeling about it? Because they are linked directly.
More and more employers need to be thoughtful about the relationship that employees are cultivating with their work. And WellSpark can help them do that in such a way that it becomes healthy for the individual and for the organization.
Everyone has their own spark, and when it comes to working with our participants, they come from all walks of life and they have very diverse backgrounds. So the Spark for Health coaching really meet with the members where they are, and we do that by really assessing their childhood, their background, their cultural background, where they come from in their community, who they are, in order to really help them move forward and achieve the realistic goals.
The idea is to have the person feel comfortable sharing their story, and my job is to listen effectively and ask thought-provoking questions that is ultimately going to help them create more awareness about where they are right now, perhaps draw up a future vision of themselves and where they'd like to go. And from that place, we can create small, incremental, realistic goals for them to get towards that vision.
That's what WellSpark coaches and nurses do. This is human to human connection and building trust. This emotional support that we're giving makes people have measurable improvement in emotional health, which has measurable improvement in financial results.
It's that one-on-one personalized touch. When I'm talking to them, I'm asking what your health goals are, where you want to see yourself next week, next month, next year. I've had people tell me that they've told me things that they haven't even told their doctor.
Sometimes our participants tell them things that they don't tell their spouse, they don't tell their family. And because that trust is there, we're unlocking and revealing what's really going on. And once they hear it for themselves because they opened up, now it's on the table and they can start working on it.
What really carries this mission is when you see the results. My experience with WellSpark goes back a number of years. I was president of my union local for 12 years, and we had a number of maintenance and service workers. About 1,500 were commercial drivers. I can remember probably about 6 months after the pilot program started, I walked into a garage and one of the participants came running up to me, and I could tell physically he was probably 30 pounds lighter, had a big smile on his face, talked about how, he's playing with his kids again, how good he felt, how the stress of having a potential bad health outcome hanging over him that pressure just lifted off of him and kind of a new lease on life. It's hard to quantify that and put a value on it. In this case, looking at these commercial drivers, New England winters are brutal. They're on call all the time. They could be plowing for 3 days straight. They're sleep deprived. The quality of food available during a storm is poor. We put some real severe demands on these folks. It affects their health. It's the least we could do is try to implement a program to try to mitigate that. And I think it's the responsibility of the employers to engage the workers and help them make it as healthy a situation as possible. I have to say, that really difficult population to reach, they really became engaged. They started to help each other. They were looking forward to the sessions. They started to talk about how they were bringing the program home to their families. And I think that's profound.
This isn't just about an employer and WellSpark. We have a problem in this country, and employers have the closest reach because everybody who has healthcare through their employer, that's a captive audience. And so if every employer would just do one thing differently to reach their populations to help them get healthier, all of us would win. And so I really feel passionate that the work we do at WellSpark is changing the world.
To develop a culture of well-being, a culture of health with a company that's different and it's disruptive. People need help now more than ever, and I really believe that WellSpark's a model that is in the right spot at the right time to help employers improve the health of their workforce in new ways and improve the health of people in new ways.